While the responsibility for keeping patients safe lies squarely with healthcare workers and doctors, there are things that patients can do to make their hospital stay safer. Like you can ask your doctor or nurse to clean their hands before touching you, especially if they're examining an open wound or an IV line. We asked patient safety advocates at a recent Safe Patient Project meeting what advice they would give to patients going into the hospital, and here's what they said.
Educate yourself as much as you can to become an advocate for yourself or your loved one.
Try to understand how the hospital works and how to get help if something goes wrong. So they need to know who is providing their care. They need to know the hospital hierarchy, who is the supervisor of the people providing their care.
Unexpected things happen and you need to educate yourself prior to those, just the simple procedures, because they may not go well.
Check with them to ask them about getting an antibiotic. If it's a surgical procedure, I would suggest that they check into that.
Investigate the hospital and the doctor.
Look up the procedure, look up the drug, look up anything you can and learn everything you can about what's going on.
Be prepared and be educated.
Patients need to have an advocate. The person that is there with you needs to be aware and ask questions.
You can have an advocate with you in the hospital 24 hours a day, and it's so important when you're in a situation to have another pair of ears, another pair of eyes.
If you don't have a relative or if you're wealthy enough, you could hire a patient advocate.
Bring a family member, bring a friend, bring a patient advocate, bring anybody, but don't do it by yourself.
Every patient has to keep a journal, and while they're in the hospital, they need to enter every health professional with whom they have contact, what that person said, and in between visits they need to jot down every question they have for the next person.
Bring a voice recorder with you to the consultation. That way it'll solve a lot of conflict and confusion if there's an adverse outcome with the surgery after the consultation.
Keep their own chart or have someone keep it for them with everything on that. Anybody who entered the room, what did they say? New medication started or discontinued.
And write down how to spell it, and then take your laptop with your power cord and look it up.
Document everything that happens while you're in the hospital.
Ask questions, and if you don't understand, ask more questions. And don't be intimidated, and it's their job to inform you as to what's going on with your care.
It's better to be sure about the decisions that you're going to make rather than to feel pressured into doing something that you might regret later on. Wait and be patient.
Healthcare is really, it's like a team sport, and a patient is the captain of that team, and you should not defer your decisions to anyone other than yourself.
You need to follow your intuition. You can do all your homework about the hospital, you can do your homework about the doctor, but if you get in there and you or your advocate really feels uncomfortable about something, pay attention to your intuition.
When you stand up for yourself, you're doing them a favor.
Always treat everybody you talk to with respect and courtesy and expectation that they will respond well.